A sleep physician is specifically trained in dealing with a number of sleep issues. When patients come and see me, they often have more than one problem. They might have a problem with sleep apnea, but they've often also got a problem with insomnia or restless legs or numerous other sleep problems that can rise up. A sleep physician is specifically trained to deal with all those sleep problems, not just sleep apnea. So we can improve the quality of your sleep and manage that holistically. You could be experiencing a number of different symptoms. You might be tired and irritable during the day. You might have problems with concentration and memory. You might have a poor night's sleep where you're disturbed frequently during the night. You might be getting up several times at night to go to the toilet. In fact, if it's very bad sleep apnea and snoring, you could be waking up with choking overnight or having problems with reflux. People commonly will wake up feeling unrefreshed in the morning with a headache, a bit like a hangover, like they haven't had a decent night's sleep. This can have long-term ramifications. People with poor sleep can often go on to develop mood disorders such as depression. Yes, I'm a consultant physician, so you will need a referral from another medical practitioner, preferably your local doctor. It's very, very important to keep the local doctor involved in management of all these problems throughout the course of your treatment, because ultimately they're your primary source of care. Not always, depending on what the problem is. If the problem is insomnia, in fact, we probably don't want to do a sleep study. We want to get on and manage the insomnia problem. We don't want it to do the sleep study in somebody with insomnia unless we think there might be a problem with their sleep that's causing the insomnia. So insomnias can often be what we call comorbid. They're related to some other problem. It's not uncommon with somebody with insomnia to have sleep apnea or restless legs or some other issue that we need to investigate via sleep study. It's a very, very useful investigation as long as we get around about 5 hours of sleep. There's other ways of monitoring your sleep, such as home monitoring, where we put little watches on you that pick up movement and tells us a little bit about the quality of your sleep. Insomnia, for instance, is a very, very chronic condition. What we generally find with insomnia is that when you first have an episode of insomnia that lasts more than around about 3 weeks, it tends to be a very chronic condition and remits over your lifetime. But there are very good management strategies that can cope with that. We use a therapy called CBT, or cognitive behavioural therapy. So we basically are trying to retrain you and give you the skill set to cope with the insomnia when it gets bad. But unfortunately, it's one of those conditions that tends to be very chronic and remitting. As for other sleep problems, such as sleep apnea, we can very, very easily treat those. They're very, very good strategies for treating sleep apnea, such as CPAP, mandibular advancement splints, in some select patients, upper airway surgery, and weight loss is very important. Most people will have sleep apnea because of their weight, so we need to work on strategies that encourage the patient to be active, have a sensible diet, and reduce their weight.